So, what is porphyria? We always talk about porphyria, but how do I really conceptualize it? How do I explain it to patients in clinic? How do I explain it to my family members who ask me, sort of what I do? So, I talk about, the importance of heme. So, heme is a molecule that's present in almost all the cells of our body. And it's the main component of, let's say, hemoglobin, which is, in the red blood cells that carries oxygen. It's also important for drug metabolism. And there are 8 steps to make heme. And porphyria is when there is a disorder or a defect in one of those steps, and that leads to a certain type of porphyria. So I kind of think about it like 2 ways. Like you can think about it as a river. So you have like sort of where the river is starting, the precursors to making heme, so succinyl-CoA and glycine, and then at the end of the river you have your heme. And porphyria is when you sort of have an obstruction in that process, or like a dam that goes up, in the river. And it's really when you turn on the faucet. Let's say that there's like a big flood and there's a lot of water sort of coming down that stream trying to make heme. But if you have an obstruction, if you have a dam there, you have a buildup of all of those, all of that water that sort of spills over and causes damage from that spillover.